Welcome to the stage Michael Nyenhuis of UNICEF USA, Dr. Drew Otoo of Merck and Company, and His Excellency José Manuel Barroso of Gavi, the Vaccine Alliance.
Hello and welcome to our discussion honoring global healthcare initiatives with a particular focus on the power and promise of vaccines. My name is Michael Nyenhuis. I have the privilege to be the CEO of UNICEF USA. Globally, we are focused on making sure that every child is healthy, educated, protected, and respected. An important part of that is our leading work in childhood vaccine distribution and administration. In fact, UNICEF ensures that nearly half the world's children every year receive their basic vaccines. And in addition, UNICEF played a key role in the COVAX partnership that delivered more than 1.7 billion doses of COVID vaccines around the world so far. I'm joined today by Andrew Otoo, president of the Global Vaccine Division at Merck. He's a career pharmaceutical professional and executive leader in vaccines with 20 plus years experience in global marketing and communications. Welcome, Drew. And President José Manuel Barroso is the chair of Gavi, the Vaccine Alliance, and he previously served as Prime Minister of Portugal and for 10 years was President of the European Commission. We're honored to have you here, Mr. President. Let me start with a question for both of you. What is one critical lesson we learned from our attempt, less successful in the early stages than we had hoped, let's be honest, of equitable access to the COVID-19 vaccine around the world? And a lesson learned that will help us with other global vaccine efforts. And José Manuel, why don't we start with you?
So thank you very much, Michael. Thank you also, Concordia, for the invitation. A pleasure to be with you here and also with Drew. I think there are many lessons to draw from this response to the COVID-19. The reality is that we failed in terms of equity, at least at the beginning. Now there are enough vaccines. There is not enough demand. That's another issue. And as you said, Michael, we created COVAX, Gavi, with UNICEF, with the World Health Organization and other partners. We created COVAX, and we were able to distribute 1.7 billion doses to 146 countries. So it's by far the biggest ever delivery exercise multilaterally. But the reality is at the beginning, we could not reach the low-income countries and the low-middle-income countries. So there was and still is some problems of equity. Why? Because there were excessive stockpiling by the richer countries. To be fair to those countries, they were afterwards compensating that with very generous donations and also very generous financial contributions. That was we have to recognize also that effort. But in fact, at the beginning, since there was not sufficient amount of vaccines, and there was a prioritization to the richer countries that could buy, to reserve, to stockpile those vaccines. So that's why, for the future, what we are trying to do together, for instance, with the G20 and others, we are trying to create a permanent funding, a contingent funding, so that the poorest, including some kind of multilateral exercise like COVAX, will not be the last in the line. Now there is a progress for the so-called FIF. It's a multilateral fund that is now being created. So for the future, and also we need some political commitment from the governments, including the governments for the richer countries, that they will in fact practice this solidarity and not to have as we had in the past. So political commitment, some contingency funding. I think that's part of the response to the issue of inequity that we have been seeing now, and I hope that it will be also the lesson for other vaccines.
Drew, thank you. Drew, your thoughts?
Yeah, Mike, thank you for having us, and congratulations to the phenomenal work of UNICEF and Gavi to make sure that the WHO immunization agenda is alive and well, to make sure that every child of every age, everywhere, can benefit from the value of vaccines. One of the things that I think we've all learned is the important link between accessibility and vaccination confidence, and the link between vaccination confidence and health literacy. And we saw in the early stage of the pandemic, a lot of online misinformation did impact confidence that people had in vaccines, which therefore in fact impacted accessibility. So that has been an important lesson. And as José Manuel just mentioned, the importance of bilateral engagement to make sure that other partners can be coming together to work to address this important issue.
Yeah, very good. And just to follow up with you on that, generally, what are pharma companies doing to increase vaccine supply, accessibility, and equity?
Sure. So the industry at large really stepped up in collaboration with multilateral partners like UNICEF, Gavi, and I've been very proud of what the industry has done in this regard. And we also have work to do to continue to make sure we have equity. At Merck, we have worked in a number of ways. The first is to create the world's first Ebola vaccine stockpile. We did this with UNICEF and WHO and other partners to make sure that our Ebola vaccine, or VIBO, can address outbreaks around the world. Just this morning, Reuters reported an outbreak in Uganda, and our organization stands ready with our global partners to ensure that we can address the Ebola outbreak. The second is our commitment to advancing the WHO cervical cancer HPV elimination agenda set for 2030. And so we have focused a number of efforts to expand our vaccine capacity. Supply is no longer an issue to make sure that girls and boys can access this important life-saving vaccine. And last but not least, we are working very hard to make sure that our commitments to Gavi-eligible countries are very clear. We have invested close to $2 billion over the last few years to make sure that, again, supply is no longer an issue, and making sure that we have access pricing for not only Gavi-eligible countries, but middle-income countries as well.
Very good. José Manuel, you've talked a little bit about maybe some of the things that governments can do a little bit differently and some of the financing mechanisms. Turning to HPV for a minute, there's been a lot of success in Rwanda, for instance, in the take-up of HPV vaccine, both the accessibility of it there, but also acceptance of it there. What's behind that, do you think? And what lessons are there for vaccine campaigns globally?
Basically, it's a question of education and the commitment also of the government authorities. Namely, by the way, in the case of Rwanda, also with girls and women. In fact, Rwanda is one of the countries that scores better globally in terms of gender equity. It's, for instance, in political terms. That I know with my head as a member also of the women political leaders. I'm a supporter of the women political leaders. It's amazing what Rwanda has been doing. And so since, as you know, HPV is critically important for women and girls, they have a campaign of education, and the government is actively behind it. And this is extremely important, because this is one of our systems of health are not typically made for adolescents. It's for children, very young children, or for adults. But for someone with 12, 13, 14 years, they typically are not the first to go to those centers, health centers. In Rwanda, apparently they were able to make this public campaign, education, so they are clearly above most of other countries in Africa in that matter. So that only highlights the need for education, working with the communities. Also the role of civil society organizations is very important, namely when those matters that relate, because sometimes there are cultural resistance. There is cultural resistance and also gender-induced distortions when it comes to some vaccines. And so the role of education and what the government and the civil society can do to promote those values is critically important.
Drew, why is Merck has played such an important role, leadership role in ensuring HPV vaccine just even developed, let alone then available to people? Why is this so important, and how do you see that in the context of the other, basic vaccines that are needed by children and young people?
Sure. So HPV vaccine is an incredible innovation. It's a cancer-preventing vaccine. There aren't that many in the world. Merck has an important one. And the role we are playing with the WHO, aligned with multilateral partners to achieve the cervical cancer elimination agenda, is very important. Over the last 15 years, we've seen a tremendous reduction in HPV-related cancer, and there's a lot of long-term durability data as well. We're committed with our partners to make sure that we can get not only boys, but girls, but boys vaccinated as well. What we've done is, again, to invest a significant amount of time and resources to expand our manufacturing capacity In fact, with Gavi, we've committed 91.5 million doses through 2025. But importantly, we also recognize that it's not just delivering doses, but how we can engage with partners to ensure in-country program resiliency, school-based programs, as José Manuel referred to in Rwanda, and again, making sure that we can make HPV vaccine available to anyone who needs it.
I want to go back to the question about demand, José Manuel, that you raised earlier. COVAX struggled first with supply. Then once supply caught up, started struggling with demand needed. We know even here in our own country how politicized the vaccine became. What do we do to make vaccines just a normal part of everybody's life and get over some of the debate about it and really create that demand?
It comes to basically, once again, to education and the government's role, enlightened leadership. And of course, to have to win the debate. As you said, and by the way, Andrew said it as well, there were, and there still are, very active campaigns of misinformation. Yesterday, walking from here to the apartment where I'm here in New York, I saw some campaigns in the street, amazing, about conspiracy theories against vaccination. So this is important, but if you have the governments actively behind those campaigns and explaining, of course, with the science on our side, because we can only win that argument with rational arguments and with evidence. And there is clear evidence. It's just, just to see the mortality of people in countries that are doing effective campaigns of vaccination, of immunization, and that is what we're not doing. It's a huge difference. So we have evidence that shows that vaccines save lives. So we have to make that part of our goals. And this is important for the developed and developing countries, including in the developed countries, as you've mentioned, including in the US, there is still a lot of vaccine hesitancy, but also in other countries where, there are so many needs, this becomes now a challenge. Now we have that challenge in Africa now. Now we have enough vaccines, but we don't have enough demand. In terms, now speak about the COVID-19. That's the situation we are now.
Yeah.
Just to add to what José Manuel just noted, industry and Merck specifically has worked hard to bring partners together to address misinformation. We're the founding partner of a group called the Alliance for Advancing Health Online. We have a $20 million commitment to looking at research grants from researchers to develop original work to understand the link between social media and health science and vaccination confidence. And just in the past year, since its inception, we've seen 33 original research projects and grants really tying and bringing much greater understanding between digital online health and misinformation and how it can be used as a force of good to increase vaccination confidence and accessibility.
Yeah. We have just a minute or so left, and I just wanted you to get a response from you both about this very unfortunate resurgence of polio. One of the most important and successful vaccination campaigns globally over the last decades has been polio, bringing it down to just a few cases in a couple of countries. And now we have a little bit of a resurgence, which comes from vaccine hesitancy primarily. Just a quick thought from both of you.
Once again, I'm really a little bit boring my responses, but it's education. Because we have the vaccines. We have the cure for this, but we don't have sufficient education. It's true that in some cases, in some countries, there's also conflicts. For instance, there are some conflicts, for instance, in the region, Pakistan, Afghanistan, there are some issues related to the overall social political situation. Having said that, it is basically an issue of education because we thought, or at least many of us thought, that that battle against polio was already won, but it's unfortunately not the case.
Quick comment, thought about it?
Importance of surveillance. We would not have caught that if it wasn't for some of the surveillance that have been put in place by states for COVID.
Yeah, very good. Thank you so much for your time and your insights, both of you, and please give a round of applause to the panelists.
Thank you.